The state is still waiting on two pending results of the highly contagious B.1.1.7 UK variant. Two cases have been confirmed so far. With the new arrival of this strain, Lieutenant Governor Josh Green says he's pushing to get people 65 years and older vaccinated as early as March the 1st. Nikki Schenfeld has the story.
The UK variants can spread rapidly, and now there's concerns over a more deadly strain that reached the U.S. just over a week ago. Lieutenant Governor Green says as long as the most vulnerable are vaccinated, hospital numbers should stay low.
It looks like one very well may be negative altogether.
Two confirmed cases with no travel history and no contact with one another suggests the UK strain is circulating.
It's very likely there are other cases out there, but the good news is our positivity rate has been steadily declining.
This strain is more transmissible because it sticks easily to oral membranes, such as in our throat. And when you sneeze or cough, someone else can easily catch it. He says for every one person who catches COVID, one other is infected. For every person who catches the UK variant, it infects 1.4 people.
That's a lot more, believe it or not. Anybody you come into contact, if you're an asymptomatic carrier, is much more likely to catch it. And so there will be fewer lucky breaks that you just didn't spread it to your significant other or your kids or, your classmate or your teacher.
He says the state could see a surge in cases among younger people who party or gather and worries they could bring it home to their parents or kupuna.
I've asked the governor and director of health to strongly consider moving to the 65 to 74 category starting March 1st because of this strain and because we're going to be getting Johnson & Johnson in soon. And if we even do get some spread from these new strains, it's not as bad, not as dangerous.
Green says the most concerning strain to look out for is the South African variants, which arrived in the U.S. over a week ago. The CDC has reported 6 cases in 3 East Coast states.
The UK does not appear to be more deadly. It's very likely that the South African strain, which we don't have here, is more lethal.
If there is a surge in cases in a week or two, Green says the state will sample data to determine if it was from a big game party or the UK strain, and encourages people to get vaccinated when it's their time.
Definitely continue to wear your mask no matter what, but do not think for 1 second that you're immune until you've had that second shot and you've had 2 weeks for it to kick in.
Nikki Schenfeld, KHON2 News, working for Hawaii.